In this video, we're going to talk about statins and why they're useful if you're a type 2 diabetic. Now, you might be thinking, doctor, my blood sugar levels are high, not my cholesterol, I don't need a statin. Well, studies have shown that if you're a type 2 diabetic, you're at an increased risk of heart attacks or strokes, even if your cholesterol is perfect. In fact, you're at similar risk if those who've already had a heart attack or a stroke in the past. And that's where we can step in to help. So why this matters in diabetes. Before we get into statins and their benefits and risks, let's talk about diabetes, how it impacts your health. As you know, diabetes is a condition where there's too much sugar in the blood, and the high sugar levels play havoc across the whole body. There are some dangers that we check on annual reviews, such as with your eyes or your feet. However, there are some dangers that are hidden, such as damage to your heart or your blood vessels. We don't know exactly the damage there is until, unfortunately, it's too late. High blood sugar levels over a long period of time can damage your blood vessels. They become stiff and narrow, making it difficult for blood to flow. Think of your blood vessels like water pipes. Normally blood flows through them really smoothly, but with diabetes the blood is sticky like syrup, and this starts to cling to the inside of the pipes, making them narrow and stiffer. Your heart has to work overtime for the blood to get around your body and can cause increased risk of blood pressure. For blockages to occur as well can be easier and at risk of heart attack or strokes. I'm not telling this to scare you. We need to monitor your heart health through blood pressure checks and maintaining steady blood sugar levels. However, the risk would dramatically drop if you were to start a statin. So the advantages. Again, I can hear you say, doctor, my blood sugar levels are high, don't need a statin. Well, yes, they do not help control your blood sugars, but they help control your cholesterol. And they tell the liver to slow down in making cholesterol, but that's not all they do. Help stabilize your blood vessels, packing the plaques that are already there against the walls and secure them and stop them narrowing and moving any further. They can also reduce the inflammation on the blood vessels so that they can work in a less stressful conditions. So think of statins as a shield for your arteries, and they work quietly in the background whilst you work hard to balance your blood sugars. This is an extra level of protection to reduce your risk dramatically. Statins and the bad rep. Now, you would have seen loads in the media about statins, and I'm not going to pretend that I've not seen them too. I have, but I want to answer some concerns that you may have and debunk a couple of these rumours. So statins do nothing, they're just for drug companies to make money. Statins are one of the most studied medicines in the world, with very strong evidence that they reduce heart attacks, strokes and deaths worldwide. In the UK, statins are generally really inexpensive to produce, and they don't have big brand names, so there's no money really making scheme behind them. Once you start a statin, you can never stop them. Well, the statins are a long-term medication, and we recommend that you take these for the rest of your life. The risk for your heart increases as you get older, and it's better for your heart to keep this shield strong. We monitor you whilst you're taking the statins. If we believe you're getting side effects, we can alter them or change them. So statins having side effects such as muscle cramps, dementia and liver damage. All medications we take come with a risk. It's our job as doctors to weigh up these risks against the risk of not taking them. Some side effects are common, such as muscle cramps and headaches, and amongst ones we see in practice. However, these can go away in time as your body adjusts to the medications. If side effects continue, we can try something different, either a different statin, lowering the dose, or something different altogether. Side effects such as change to your memory and liver damage are much rarer and only occur in a very small handful of patients. We believe the risk of you having a heart attack or a stroke in the next 10 years is far higher than the chance of you developing these serious rare side effects, so we strongly recommend them for you. If you decide you want a statin today, we can start you off on atorvastatin and have a check-in at 3-month mark. This will include getting your bloods done to see what your cholesterol is doing, and we're looking at, and once you've started it, we can check on your liver as well and make sure there's none of these side effects that we've talked about. We can adjust your dose depending on how you're feeling, and we aim to have a 40% reduction in your cholesterol whilst on a statin, so we need to make sure things are moving in the correct direction. Never hesitate to get in touch if you experience side effects. We can always swap to a different statin, such as rosuvastatin, or a completely different drug altogether, such as ezetimibe. So, I hope you found this short video has been useful and help you understand the importance of statins and what crucial role they have to play in protecting your health when you have diabetes. If you want a bit more research into statins and diabetes, please follow the links in the description to some very helpful websites and other videos that we've done. If you've sent this video via a message, please respond back with what you want to do, and we can sort of take it from there. Thank you everyone, and I'll see you around the practice. Dr. Dave Hymos, Eaglescliffe Medical Practice. Stay safe.